and we're going to actually talk about the endocannabinoid system. There are two main receptors, and that's what's listed here, the CB1 and CB2. Important thing to know about CB1 is actually mainly in your central nervous system and the brain barrier, and aren't able to reach these receptors. So you see that indicated in this slide is CBD as the key, and so that's the way these receptor sites work. They have a very particular shape, and if your molecule does not match that shape, it is not able to bind to these receptor sites, and it's not able to stimulate a neurological response. And sometimes things can actually get on the receptor site and block an active molecule from creating a physiological response, but that doesn't happen as much in the central nervous system because so few chemicals are able to cross the blood-brain barrier. But it happens more in the body, the rest of the body, where the CB2 receptors are, and you get all these chemicals that we've man-made that tend to get on these receptor sites and block them. And we'll talk about how you should watch out for synthetic CBD oils because they can be quite toxic to the system. So the CB2 receptors are mainly in the immune system, and that's where you're getting your immune benefit. So if you think of CBD oil getting on these receptor sites, that's when you start to upregulate physiology and upregulate function. The big ones with the CB1 and CBD2 receptors are increased neurological function with CB1 and increased immune function with CB2. But the CB2 receptors are distributed throughout all of your organs. Now, the interesting thing about this cannabinoid system is there's no receptors in the area of your brain where you can have addictive behavior. So there is no addictive properties to EVE. It has never been proven to be addictive. And even when we go back to the patent that is of course owned by the United States, and we read here, it says there are no signs of toxicity or serious side effects have been observed following chronic administrations of cannabidiol, which is the technical name for CBD, to healthy volunteers, even in large acute doses of 700 milligrams a day, which is a pretty large dose. Most people are much lower than that, 200 milligrams or below. Probably a normal dose is more around 100 to 50 milligrams. So no toxic side effects. And that's important to me, and I know it's important to you or you wouldn't be on here listening to this. The whole system is so beneficial to upregulate so that we can prevent a lot of these inflammatory disorders. Now this, the main receptor here we're looking at is the GPR119. And GPR119 is very, very unique. It is for pain control. And this is kind of where initially, especially the use of medical marijuana, but now the use of CBD has gained so much popularity. We all know, and we've all seen on the news, the dangers of opioids and the severe risks of addiction to opioids and people dying from these overstimulation of opioids, because here's what happens, just like I alluded to earlier, is with a lot of these substances, they do not stimulate this GPR119 molecule. They're mainly anesthetizing your body, so they're down-regulating everything. And people just take more and more and more until they down-regulate things so much that they die. They down-rate their respiration rate, they down-regulate their heart rate, and they literally move themselves into a drug-induced coma and pass away. But CBD oil does not do that. It has a direct effect on the C neurons, which are your pain-transmitting neurons, through this GPR119 receptor site. And your typical opioids have no effect on pain. They just anesthetize the body. So that's a huge concept to grasp, so that you realize that the more you take of that, the more risk you are of lowering the function. And you see these people that are on these opioids, they're just zombies because they're so drugged up, and they aren't even a functional human being anymore, but they have to get in that state to avoid their chronic pain. But this is the answer for them, because this naturally inhibits pain transmission through the C neurons that are the pain transmitters of your nervous system. And that's what makes CBD oil so unique, is this whole pain control aspect. Now you add on top of that the anti-inflammatory aspect. If you have studied chronic degenerative diseases at all, you know it all starts with low-grade inflammation that affects whatever system you're talking about. So, for example, low-grade inflammation of the cardiovascular system leads to strokes and heart attacks because you get the plaquing. Chronic low-grade inflammation of the brain leads to Alzheimer's and Parkinson's because you get the plaquing up in the brain. And we could go on and talk about all the different systems and how that chronic low-grade inflammation ages the body. It ages your skin. It causes the things that we typically don't want to do. So CBD oil is known as the new anti-aging, anti-inflammatory ingredient that you can add to a healthy, health preventative wellness lifestyle. So you don't have to have symptoms to benefit from CBD oil. And that's what I want you to understand. So let's talk about the many benefits of CBD. Well, we probably don't have the time to go into all of them. We can go to the next slide, though. But I do want to talk about the varieties of cannabinoids. So you have the endocannabinoids. Those are the ones that are produced in your body. And we already talked about one of them. Then you have the phytocannabinoids. That's the CBD, the THC. Then you have the synthetic, and that's the bad stuff that you don't want to buy. And if you look down in the right-hand corner of this slide, that's some of the names. So if you're looking at a product and it has some of those names, you don't want to buy that product. There was just an article that I shared earlier in the week about many of people having horrendous side effects from using these synthetic cannabinoids. So make sure that you are not using them. And that's why, again, we're doing this webinar because we want to make sure that you're tapping into a company that has integrity and is going to give you a product that you're going to get good results with, and it's going to give you the benefits that you are desiring, as well as removing the risks that come with synthetic compounds. So I'm so thankful to have found a company that is so conscientious and has carefully researched the different growers and selected a specific grower from Europe that they get all their hemp products from, and we'll talk about that in a minute. So as I was saying, there are many benefits to CBD oil, and you see some of them listed here. Now, one thing that I want you to notice is you'll see CBDA. That is the acid form of CBD. It is useful, and there are some benefits, but it is not easily converted to CBD, which is the active form of the cannabinoid that needs to be in your body. Same thing with the THCA. There are benefits there, but it's an acid form and it's less beneficial. So you'll see when we show you the product, the analysis of the products that we use, the raw products that we use, they have a very low CBDA and THCA content. The CBD period is the most beneficial ingredient, and as you see, has the longest list of benefits, and it also has the longest list of research that's out there. So it plays an important role in skeletal remodeling and upregulating your bone mass. And as we get older, we know that more and more people are getting osteoporosis and osteopenia, so that's an important function that CBD oil can play in your health picture. Also, I've already talked about the anti-inflammatory properties, but think about all the people that end up with arthritis. And arthritis of the hands is particularly aggravating, and this will help with that. And I want to talk about the three ways that you can consume CBD oil as well. They do make a salve, so you can specifically rub it on your hands. where you're having that arthritic type pain and it goes more directly to that area. The salve is also very beneficial to skin lesions. So if you have, I had a patient in this evening with, believe it or not, poison ivy in the middle of winter, but they did. And so we gave them some salve so that they could use that to get through this irritating time. It's also super beneficial. This time of year, I see lots of people's fingers cracking and getting super dry, and of course that's hugely painful. I mean, the salve heals that up virtually overnight. I see a lot of people that have the same cracks in their feet and their toes and have bad lesions, etc., on their feet from poor circulation or degeneration in the nervous system that doesn't allow good health and nutrition to get down to your extremities, and the salve is super beneficial there. You also can use of course, the typical oil form, and you can take that orally. Best to do it under the tongue where you have the most neurotransmitters, and kind of hold it in your mouth a little bit and swish it around is the recommended way to do it. Also, they have a oil that you can put in an e-cigarette. And the benefit about that, if you do have a severe condition that, you need to get it into your system very, very quickly, then that is the most immediate way to get it into your system. So one of the benefits of CBD oil is it does help to reverse the effects of a seizure. And so if you're able to get that in somebody's system, in that case, you might have to blow it in their face because they might be seizing and not able to even suck on an e-cigarette. But that has been shown to have tremendous effects. And then, of course, over time, once they get that CBD oil in their system, then it actually prevents the seizures from happening. It also helps prevent strokes because of its neuroprotective elements. And then it even augments stem cells, and we've heard a lot of research about stem cells and the benefit of stem cells, but those are the cells which are kind of allow every type of cell to develop in your body. So it's kind of like the baby cell that differentiates into every other type of cell. And then if you have an autoimmune condition like Crohn's, psoriatic arthritis, rheumatoid arthritis, it helps with that, and it even improves sleep. So lots of benefits, and that's just a short list of benefits of the CBD oil.